Level 1, the pre-med. You're 18. If someone collapses in a locked room and nobody checks for 20 minutes, is that negligence or just routine? You don't hear this question in a classroom. You hear it from a correctional officer who says it casually, like he's talking about the weather. You're standing inside a prison intake corridor on a school visit you almost skipped. The walls are concrete, not painted to look nice, not softened, just concrete. The lights are fluorescent, too bright to feel comfortable, too cold to feel human. Everything echoes, but not voices. Doors, metal doors, each one slamming shut like a full stop at the end of a sentence. You're not supposed to be focusing on that. The guide is talking, something about rehabilitation, something about structure, something about opportunity. But your brain locks onto something else. A man sitting on a bench against the wall, orange uniform, hands resting on his knees. Not restless, not aggressive, just still, too still. He looks up, not at the guide, not at the guard, at you. Out of everyone in the group, you. And he says, "Hey, how long does it take before someone notices if something's wrong?" Not loud, not dramatic, just direct, like he's asking for a time, like there's supposed to be a number. Nobody answers. Not the guide, not the guard, not the group. The moment just passes, like it never happened. But it did, and now it's stuck. You leave the facility. The sun feels aggressive, too open, too wide, too free. Your friends start joking about how weird that was. One of them says, "Imagine being stuck in there." You don't respond, because you're not imagining being inside. You're imagining being responsible. That night, you don't tell your parents anything. You don't make a big announcement. You don't say, "I want to be a doctor." You sit in your room, laptop open, cursor blinking. You type, "Who is responsible for inmate medical care?" You expect a system, a structure, a clear answer. Instead, you get fragments, legal frameworks, budget discussions, understaffing reports, a few doctors describing it as different, challenging, not what people think. That last one sticks, because nobody explains what it actually is, and that uncertainty, that lack of clarity, pulls you in harder than certainty ever could. You don't decide out loud. You don't commit in a dramatic moment. You just adjust direction, quietly. You choose pre-med, and you carry one question with you. What actually happens inside those walls? Level 2, the medical student. You're 22. Your life becomes systems. You learn the body like it's machinery. Input, process, output. You learn that if something breaks, there's a reason, and if there's a reason, there's a fix. Medicine, in theory, is clean, logical, predictable. You memorize pathways until they feel automatic. You solve case studies like puzzles. You get good at it, very good, because puzzles have answers, and answers feel safe. But then, small cracks start appearing. A lecture on patient compliance. Patients who follow instructions have better outcomes. Everyone writes it down. You pause, because you're thinking about that man again, the one on the bench. You don't think he ignored instructions. You don't think he had instructions. That's different, and medicine doesn't talk about that difference much. So you start reading outside your syllabus: correctional healthcare, addiction medicine, mental illness in confined populations. You notice something immediately. Nothing is clean here. A patient doesn't just have diabetes. They have diabetes plus addiction, plus trauma, plus no control over diet, plus no ability to leave. Everything stacks. Everything overlaps. Everything complicates everything else. You realize something uncomfortable. Everything you're being trained for assumes a patient who has choices. You're interested in patients who don't. During a pharmacology lecture, the professor says, "This drug requires strict adherence." You write it down. Then you add your own note underneath. What if adherence isn't possible? That question doesn't get answered. So you keep building your own framework, one that fits a world where patients don't choose their meals, patients don't control their time, patients don't always trust the system treating them. You become quieter in class, not disengaged, focused. You're no longer just learning medicine, you're comparing it, testing it, asking, does this still work when control is removed? Most of the time, you don't like the answer. Level 3, clinical years. You're 24.
You finally step into real medicine, hospitals, rounds, actual patients. Everything speeds up. You touch real cases, real consequences, real outcomes. It's intense, but it's structured. There's always a system, always a backup, always someone above you. Then you choose an elective, county jail clinic. You walk in, and immediately something feels off. Not wrong, just different. The space is smaller, the walls are harder, the air feels heavier, not physically, mentally. The nurse hands you a clipboard. She says, "Keep it short." You nod. You don't understand yet. Your first patient sits down, doesn't make eye contact. You start normally. "Hi, I'm..." He cuts you off. "What do you need?" You pause. That's not how this usually goes. You ask questions. He answers in fragments. Short, efficient. You try to explain a diagnosis. He stops you. "Doc, nobody needs the whole lecture." You glance at the clock. He's right. There are 5 more patients waiting. You adjust. Shorter sentences. Direct questions. No fluff. Something shifts. You're still practicing medicine, but differently. More compressed. More targeted. More real. Later, you try to take a full patient history. The officer outside the door taps the window. Time. You realize something instantly. Time isn't just limited here. It's controlled. And that changes everything. You step outside between patients. You ask the nurse, "Why does everyone seem so rushed?" She looks at you like the answer is obvious. Because they are. You don't ask more. You don't need to. By the end of the day, you understand something clearly. This isn't medicine with fewer resources. This is medicine in a completely different system, where time is restricted, movement is restricted, trust is restricted, and yet the need is the same. Before you leave, you ask, "Do students usually come back?" The nurse shrugs. "Not really." You don't respond, because you already know you will. Level 4. Intern. You're 26. You thought you understood pressure. You didn't. Intern year removes all illusions. You don't have time to think. You act. Then you think about what you did later, if you're lucky. Your pager goes off before you finish reading the last one. Your shift doesn't end when the clock says it does. It ends when the work stops. The work doesn't stop. You start measuring time differently, not in hours, in tasks, in patience, in problems. One night, just after 2 a.m., a patient arrives in restraints. 2 correctional officers, hands cuffed in front, ankles chained. He's breathing fast, too fast. Chest pain, real chest pain, not anxiety, not vague discomfort, the kind that changes the room instantly. You move closer. The officers don't. They watch. You reach for your stethoscope. Then you hesitate, because there's a layer here that wasn't in your training. You look at the officers. They ask before you do. You want the cuffs off? The question hangs. It shouldn't be complicated, but it is, because this isn't just medicine anymore. It's security, risk, protocol. You think for half a second. Then you say, yes. They unlock him. Just like that, the metal comes off, and something shifts, visibly, immediately. His shoulders drop, not completely, but enough to notice. You examine him. You focus. Heart sounds, pulse, ECG, everything becomes normal again. Clinical, structured, controlled. For a moment, he's just a patient, nothing else. You call it. STEMI. You move fast. Cath lab. Team activated. Everything clicks into place like it's supposed to. Because in the hospital, systems work. You watch him go. You don't follow. You don't need to. You did your part. 20 minutes later, you see him again, alive, stabilized, and the cuffs are back on, exactly where they were before. Same wrists, same person, different state. You stand in the hallway, and something settles into you. The medicine didn't change, not once, but everything around it did, and somehow that matters more than it should. Later, your senior resident finds you. She doesn't ask what happened. She already knows. She says one thing: the disease doesn't care where the patient came from. Then she pauses, and you shouldn't care either. That stays with you.
Level 5. Junior resident. You're 27. You're not the lowest anymore. That sounds good. It isn't. Because now, people look at you for answers. And you have them, sometimes. Other times, you have to act like you do. You rotate back into a jail clinic. Same setting, different role. You're not observing anymore. You're deciding. 30 patients. One day. No backup. No specialists. No time. You move fast, but something feels different. You're noticing things you didn't before. Patterns, gaps, silences. A patient walks in, early 20s, doesn't sit fully, half standing, guarded. You notice his arm, wrapped, poorly, duct tape, layers of it. You unwrap it slowly. The smell hits first, then the wound. 3 days old, maybe more. You don't react, not externally. You just say, "Why didn't you come earlier?" He laughs, not amused, just tired. "Come where?" That lands hard, because it's not sarcasm, it's literal. You clean it, irrigation, debridement. You suture it, carefully, precise, the way you were trained. He watches the whole time, not nervous, not afraid, just watching, like this matters more than it should. When you finish, he says, "You didn't get mad." You pause. "Why would I?" He shrugs. "Most people do." You don't respond, because now you understand something new. The baseline expectation here is not care, it's judgment, and anything above that stands out. Later that day, a different patient sits down, older, calm, too calm. He hands you a bottle, medication, blood pressure. You check the label, 12 years, same prescription. You ask, "Do you know what this does?" He thinks, longer than expected, then says, "It's for blood, right?" That's it. 12 years. No explanation, no understanding, just compliance. You grab a piece of paper. You draw. Simple. Heart, vessels, pressure. You explain. 7 minutes. That's all it takes. 7 minutes that no one gave him in 12. When you're done, he nods slowly, like something finally connected, like something finally made sense. And you realize, this isn't advanced medicine. This is basic, but basic done properly. And that's rare here. That night, you don't feel accomplished. You feel aware, because the problem isn't complexity, it's absence. Absence of time, absence of explanation, absence of consistency. And you're starting to see how much damage absence can do. Level 6. Senior resident. You're 28. You can feel the end coming. Not emotionally, structurally. You're almost done. Your skills are sharper. Your decisions are faster. You don't hesitate the way you used to. You recognize patterns instantly. You manage chaos without thinking about it. You've become what you were trying to be. And now, you have to choose what to do with it. Everyone else seems certain. Cardiology, GI, pulmonary, hospitalist, clear paths, defined ladders, recognized prestige. You sit with your options. You look at them. They all make sense. None of them feel right, because every time you imagine your future, you don't see a hospital. You see a locked door, a narrow corridor, a patient who doesn't expect to be listened to. That's what stays. Not the procedures, not the complexity, the gap, the space where care is inconsistent, where systems don't fully reach, where people fall through. You try to explain it to someone, a co-resident. They laugh. Why would you choose that? You don't answer immediately, because you realize you can't explain it cleanly. It's not about saving people. It's not about making a difference. Those are easy answers. This is something else. You finally say, because someone has to show up there. They don't get it. You don't try again. Because this isn't a logical decision. It's directional. You apply 3 systems, all correctional. You expect hesitation. You don't get it. All 3 offer you a position. That tells you something immediately. This field isn't limited by need. It's limited by willingness. You choose the hardest option, not the best location, not the best pay, the place that feels least supported, because that's where the gap is largest. On your last day, your senior finds you. She says,
You're going to see things most doctors don't. You nod. She continues. Don't let that make you think you're different. You wait. She finishes. You're not different. You chose different. That stays with you. Because she's right. This isn't identity. It's decision. And decisions you have to keep making every day.